when I was in search of community. So I basically knew something was wrong when I was avoiding my kitchen. I would walk around the kitchen. I would walk past the kitchen. I was avoiding washing the dishes. And I knew why I was avoiding the kitchen and washing the dishes. I was scared of knives. At this point, my daughter was 3 months, and I kept thinking, what if I harm her? Like, what if something happens with the knife? Like, what if I go in the kitchen and she's harmed? Or what if I wash her in the sink and she drowns? I was so uncomfortable. So I decided to reach out to my family members. And I reached out to my mom, who has 8 kids, and I said, Mommy, I didn't tell her about the knives because I was ashamed of that. So I just told her, Mom, I'm having some really crazy thoughts when it comes to Bean, that's my daughter, and it's scaring me. And my mom's response was, girl, please. We all have those crazy thoughts. You need to push through. On my 4th baby, I didn't even want to feed him. I used to turn my head and feed him because I didn't want to be anywhere near him. And I said, well, why didn't you say something? And she said, because I had 3 other kids to take care of, and I had to do what I had to do what I had to do. And so I knew that I wasn't going to find any help there, because she had experienced her own postpartum mental illness and didn't address it. So then I started to speak to other family members. I spoke to one of my cousins, and prior to having a baby, I was always labeled as a drama queen, right? So my cousin, who's my age, she has 3 kids. And I said, oh my God, I'm so worried. I'm checking the baby 3 and 4 times in an hour. I'm not sleeping. And she said, I told you when you had the baby, you weren't going to be sleeping. And I said, no, it's something else. I'm trying to explain to you. This is really like, I'm not sleeping. I'm up, I'm pacing, something's going on. And she was like, you are so dramatic. You're just having your baby at 33. We've already been through this. You'll be fine. You're just being dramatic. So I didn't find any help there. Then I decided, hey, let me call my OBGYN, because I wasn't getting the help that I needed to get from my immediate, support system. And I called my doctor, and I'll never forget this. And I had a great doctor, and I had a great birthing experience. But this is where that line of communication kind of fell through. I called my doctor and I said, hey, something's going on. I'm having like all these thoughts. I'm really scared. And his response was, yeah, a lot of women go through that. And I could tell he was rushing me on the phone. And I was like, wait, no, like it's really bad. Like something's going on. He said, I'm going to send you Zoloft to the pharmacy. And I remember thinking, like, I've seen the Zoloft commercials and I don't feel that way. I don't feel depressed. And he was like, no. Listen, he cut me off mid-sentence and said, you need to focus. You said that you are not feeling like yourself. This does very well with all my patients. I don't have a lot of time. I'm sending it. I never picked up the Zoloft prescription. So I did what any sane person would do next. I went to Google because at this point I realized that I wasn't going to get help from family, and I wasn't getting help from my OBGYN. So let me go to Google. I went to Google, and Google told me I had everything. Not only did I have postpartum mental illness, Google told me that I had lupus. Google told me I had all of these different things. So now I'm really struggling. And I'm like, oh my God, like what's happening to me? Like, am I going to be like the lady who drove her baby into the water? Am I going to be like, the lady who tried to set herself on fire? Like, is this my path? So I continued to search through Google, and what I did find, I started to find forums. I found forums where women were talking about what they were experiencing. So it wasn't coming from like a medical website. It was actually women speaking to each other. And I remember one woman saying that she was having all of these thoughts as well. And it was something called postpartum anxiety OCD. And I was like, what the hell is that? I have no idea what that is, but it sounds like something that I'm going through. I'm going to diagnose myself at this point And that's what I think I have. So I started to Google that word, right? Postpartum anxiety, OCD. And it seemed like it fit me, right? So after that, I remember I reached out to my very, very good friend from high school, Colette, and I said, hey, I think I'm having something called postpartum anxiety, OCD. And she said, well, you should try to find a therapist. And I was like, okay, well, I'll try to find a therapist, but let me go back to my Dr. Google and figure out what I can do here. So I went back to Google, and what was troubling me at the time was I wasn't receiving any experiences from women that looked like me. All the women I was chatting with, they were all white. And I'm so thankful for their words and sharing their experiences, but I couldn't relate fully to what they were experiencing. And I'm like, Black women and postpartum, and everything that kept coming up was like stats, really short bits of information, but no experiences from their own mouths. And I was like, well, this doesn't make sense to me. I can't be the only Black woman going through this. And so this pivotal moment, I find a BuzzFeed article, and it said, Black women are suffering in silence. And it gave 10 stories of Black women who had postpartum anxiety, OCD, or postpartum depression. And a couple things registered with me when I read that article. All of the women were struggling to identify with what they were experiencing when they were experiencing it. So they're like, what the hell is going on? I don't know what's going on. I'm confused. They all had reached out to family members who kind of like pushed it to the side. You know, you got to keep going. They all felt like they were going crazy. At this point, I thought I was crazy. So they all felt like they were going crazy when they were experiencing it. They all questioned their abilities as mothers. I was experiencing that. But the most important thing from this article, and I feel like this is what changed my life, is that they all got better. And I remember reading that they were all better because they had all gone to therapy. And I was like, oh, Colette was right. I need to go to therapy. So here I am with this article. I'm going to find a great therapist the first time. So my first therapist was a very nice older white woman. And I really liked her. She was really sweet, but she seemed so disturbed by how upset I was. She kept telling me, hey, like a lot of women come to therapy. A lot of women go through this, like you'll be okay. And when I would cry, she would cry. And I was like, this is probably not the right situation for me, because it seemed like she was troubled as a mother, right? Like she was going through, like she was feeling so bad for me, and I could feel that. So I didn't feel like I was gaining any power in that situation because we was both sad. You know, she's like, oh my God, I feel so bad. I was like, so do I. And also she was completing her coursework and asked if she could record our sessions. And I'm Black. I was like, wait a minute, pause. No, you will not be recording my session. I'm going to move on to the next. So the next therapist, she was actually a psychiatrist. And I remember speaking to my very good friend Colette about this woman. She immediately gave me Xanax, which was a red flag. She didn't even know what was really going on with me. She goes, here's Xanax. I'm like, okay, that's interesting. And when I told her what I was experiencing, she's a Black woman, she goes, oh my goodness, I probably was going through the same thing when I had my kids. And I thought to myself, okay, so I appreciate her relating to this, but it felt like she had her moment of epiphany while in therapy with me, and I was not comfortable. So my next experience was I went back to Dr. Google, and I knew at this point through all of this searching for a therapist that I needed a behavioral therapist, right? So I found my therapist, Dr. Shinar, in the city. And immediately what I noticed with him was that my first session, I was comfortable. He wasn't scared. He didn't seem like he was scared or anxious about what I was sharing. He seemed like, oh, this, very sound in what I was experiencing and said, you know, I can help you. This is a big deal to you, but this happens all the time and we're going to get through this. You're going to get through this, but you have to do the work. And this was the first time that I felt a medical health professional had put power back in my hands. They said, you're going to do the work. Everyone else was kind of like, let's look at medication. Let's take this medication. You'll be okay. There was no point when anyone else said, this is what you can do, and I can help you navigate this area. So I am very thankful for that. In addition to Dr. Shinar, at this point, I was going to therapy weekly, and I told myself, I'll give myself a year, right, before I even try medication. I'll just give myself a year. And I told Dr. Shinar that, and Dr. Shinar is a psychologist. He's not a psychiatrist. So I spoke to Dr. Colette, and I said, hey, things are not going well, but I don't want to take medication. I don't feel like that's the avenue for me. And we had a 2-hour phone call. And during that phone call, she told me, this goes far beyond postpartum for you. There are some things here that you've been experiencing. So you may need help right now as a mother, as a graduate student, as a full-time employee. You may need help to get over this hump. And so that really, I felt like that moment was really when I decided to take the power back for my life and fully start on my postpartum wellness journey. And with that said, I'm going to turn it over to Dr. Poole.
Good afternoon, everybody. Thank you so much, Jade, for sharing your story. Like, just being your friend for all these years, I'm just so proud of you, and I just love the strength that you exude, and how you not only took the power back in your hand, like you didn't stop. At every barrier, you kept going. You health and wellness was so important to you that you kept looking for an answer, and that is the tenacity that we all need. Especially when we're when our mood and our thinking is disturbed. So really quickly, I'm an adult and a child psychiatrist. What that means is I'm a medical doctor, just like a pediatrician or a surgeon or like an OBGYN, except I specialize in helping adults and kids with their mood, their thinking, their feelings, their behavior. After I see them, sometimes I say they need medicine, or they might need therapy, or they may need both. So that's what my specialty is in. And so, and today we're going to be talking about postpartum depression. So I want to start by defining what it is. So postpartum depression is just a depression that occurs after childbirth. And it's not just depression, and I like how Jade is mentioning about the anxiety, OCD. There are other mental illnesses that can occur. So sometimes, I don't know if you guys have ever heard the term baby blues. Okay, so there's baby blues, postpartum depression, and then postpartum psychosis. Okay, to give you a little bit of information about it, who gets these things, what happens, like how many people, what kinds of people, etc. So some research from the Center for Disease Control shows that about 1 in 8 women experience symptoms of postpartum depression. But so that, 1 in 8 women, but however, 85% of women actually have some change of mood after they have a baby. There's a bunch of different reasons for that, and I'll talk about that in a little while. So for postpartum depression, 1 in 8 women, but in some states, it's as high as 1 in 5 women. That's a lot. That's a lot of women that are struggling with their mood. And the problem here is that Black women are twice as likely to have some alterations in their mood after childbirth. However, they are less likely to be diagnosed and to receive treatment. There are multiple reasons for that. I saw a really good article in Psychology Today talking about the Black woman superwoman syndrome, and how sometimes that is a barrier to care. Some women are afraid that if they verbalize these thoughts that, oh my gosh, DCF or Child Protective Services is going to come and get me, which is not true, But however, we associate some of these feelings with weakness, and we don't want to be at any cost, associated with weakness. And then, as Jade was saying, with her experience with her OBGYN, people are like pressed for time, and then he's rushing her on the phone, and she's like, no, I'm experiencing something, and then she's meeting some resistance there. So there are multiple reasons for why that stat is in place, but it's staggering and it's sad because Black lives, we matter, and we shouldn't have to be suffering in silence. So, okay, I'll give it, I said 1 in 8 women, but I'll make it into a percentage. So between 10 to 15% of women suffer from postpartum depression. It goes up to 20% if you include the other things like anxiety, OCD, and psychosis in there. Some of the risk factors, that's like you're at risk to experience postpartum depression if you experience these things. If you have stressful life events, you have low social support, you have a previous history of depression, specifically a previous history of postpartum depression, if your family has had depression, if it was difficult for you to get pregnant, if you're the mom of multiples, twins, triplets, like that, if you're a teen mom, if it's preterm labor, and if you've had complications in your pregnancy, and if you have a child that's hospitalized. So those are some of the risk factors. So these are things that nurses, doctors, other people should be kind of picking up when you go to to your appointments, that, okay, this is somebody that's at risk. However, in Black women, sometimes this doesn't happen. We can hit all those checks, like, okay, they have this, and still we're not asked the appropriate questions. So it would behoove us to actually be advocates for ourselves, and then tell our providers what we are going through, what we are experiencing, what our risk factors are, so they can connect the dots and help us. I'll tell you some symptoms of baby blues, and then I'll explain the difference between baby blues and postpartum depression. So baby blues, you'll have some mood swings, anxiety, sadness, irritability, crying, feeling overwhelmed, trouble sleeping, appetite problems. That's the baby blues. And this is within that 85% of women who experience a change of mood after they have a baby. I experienced a change of mood. I remember when I came home with my firstborn, I just sat in the room and I cried, and I don't know why I was crying. I was crying. And my mom, thank God I had support from my mom, was there with me. And I'm crying, and I'm like, I can't protect him anymore. He's not in, I don't know what I was going through. I was just crying. And my mom just looked at me. She said, you'll be fine. We go through this, and, go ahead, let it all out. And your hormones are real. All these things she was telling me. I was like, okay, that makes sense. And that was the last time I cried. Like, it just kind of like went away. That's what baby blues is. You have a temporary change in mood. It's not as severe. It might last maybe a couple weeks or so, and then it goes away. So what postpartum depression is a more serious, more permanent mood change. Signs and symptoms of this could be excessive crying, these severe mood swings, withdrawal from family and friends you're trying to isolate, sometimes isolating from the baby. Like, I had a patient that would come in and she would put the baby on the opposite room as where she was sitting, and it was just like, oh my gosh, like, there's a lot going on here. Loss of appetite, can't sleep, overwhelmingly like just a loss of energy and fatigue, intense irritability and anger, a feeling of hopelessness, feeling like, oh no, I'm not a good mother, worthlessness, shame, inadequacy. Sometimes severe anxiety and panic attacks could be part of depression. Sometimes I explain to patients who are having mood problems like depression, and they also feel anxious. I tell them that sometimes where depression is driving, anxiety is a passenger, and kind of vice versa. So some of those poor mood symptoms can really cause you to feel anxious, and it just takes a good professional to be able to tease out what's going on. That's why it's so important to seek help, because you're not going to be able to understand kind of what's going on by yourself. Also within the postpartum depression, if it's very severe, you can have thoughts of wanting to harm yourself or your child. And this is where it kind of gets out of your hands at this point. You're going to need somebody else to come in and help you. There's, like I said, I posted the hotline numbers, there's text chat lines and things like that, but you're going to need somebody to kind of like pull you out of the corner that you're in. So why is this period so delicate, right? It's like, okay, you can be depressed at any point in your life. Why is this postpartum period so delicate. So as a psychiatrist, when I am looking at a patient, I see you as three things. I see the biological part of you, the psychological part of you, and then the social part of you. So when I am studying, like I'm listening to your story, I'm looking at your labs, I'm hearing your history, I'm putting everything together to figure out what's going on. So I'm going to call it biopsychosocial. And so this period is so delicate because there are changes, like significant changes in all three of what the things that make you you. The biological part of you. Your hormones are increasing and decreasing. There's estrogen and progesterone, and so your body, your hormones are fluctuating. And then there's breastfeeding. Some women go into a deep depression if they can't breastfeed. Some women, I've had a woman whose trauma was reactivated. She was raped, and her trauma was reactivated by the baby suckling, and she couldn't feed the baby so there's lots of things going on. So I told you about the estrogen, progesterone, thyroid issues, sleeplessness. So like the baby's now, waking up in the middle of the night, you're feeding the baby, that's changing your sleep cycle, which is affecting your biology, okay? So there's a huge change biologically. There's a huge change socially, whether you're with a partner, without a partner, have support from your mother, don't have support from your father. Like, there's a lot of social changes going on. I'm not working now because now I need to be home with this child. What kind of mother am I going to be? There's psychological things that are in play here as well. And these psychological things, you may not even be aware of these things because of what we call genetics and epigenetics. These are these are changes that were in your grandparents and mom and dad that are conferred upon you, that are in you, and you have no idea. You have no idea that they're there until a situation kind of activates a certain type of protein expression. These are all big words for, like, sometimes trauma, mood changes, all that stuff is wound up in your DNA. And when you're in the right situation, it activates a certain situation, and you look back and your mom might say to you, I went through the same thing. The grandmother might say, I went through the same thing. And it's because these things are sometimes wound up in our DNA. When I was talking to the ladies yesterday, I told them about this really interesting study. This study really impressed heavily upon me because it just showed the importance of that postpartum period between mom and baby, and not just for the mom and the baby, for generations to come. So there was this study about monkeys. They took a pregnant monkey. The monkey had the baby, and then they created an environment of scarcity. They hid food so the monkey couldn't just get the food comfortably and then take care of the baby. So what the mother monkey did was put the baby down, go find food, come back, and then with the food, and then took care of the baby. This is negligence, and this is something that is usually not in the regular monkey experience. They usually are with the babies all the time. But because they created this scarcity, it caused the mother to be negligent, and she left the baby. So what happens when that baby monkey grows up and has her own babies, whether there was scarcity or not, she would neglect her child, because it was just wound up in her DNA. This is something that's supposed to happen. And so when you go to a healthcare professional who is trained to kind of pick apart what's going on, we're looking at you biologically, socially, and psychologically. We can sometimes help to pick apart those experiences that you may or may not even remember because you went through it when you were but before you even had words and language to explain what was going on and how some of these things are locked in your DNA. I said all that to just let you know how important it is to seek help, because this disorder is treatable. And that's what's so a shame about it, that this is not something that we have no idea what it is. We have no idea how to treat this. No. We have lots of effective treatments, whether it be therapy, whether it be medication, or whether it be a combination of both. We have effective medications for during pregnancy, for after pregnancy, while you're breastfeeding. We have specific medications that are FDA approved, meaning they did research and studies to show and prove that this is healthy and safe for pregnant and breastfeeding women. So we have actual medical treatments, whether it be Zoloft or Luvox or Prozac. These are drugs that are safe and effective, but you have to reach out and ask in order to get the help. And then also, I like what Jade talked about, her difficulty in her that journey in finding a therapist. You have to find somebody that you vibe with, because this is going to be like a practice relationship. It's supposed to be a safe space where you go and you talk and you share, and they start to be able to see the way that you're coping with things. They see your pattern of thinking, and they're able to challenge you to help you change that. Not every psychiatrist or psychologist or therapist that makes you angry is a bad one, because sometimes there's work that needs to be done in that tension. I sometimes I work with my patients. I'll make them laugh, and I'll say, all right, you're not about to like me, because I'm about to tell you something that's going to be very real. You may not like this, but because I developed such a good rapport with them, and they know that Dr. Poole's not going to just abandon me. She's not going to discover this bad, horrible thing about me and just leave me. They're able to tolerate it, the challenge. So don't always run away if there's something that you don't like. Sometimes you have to work through the tension, but you also have to be able to recognize when your therapist is crying with you and you're feeling powerless, that may not be the right space or for your healing. Another thing that I cannot just speak highly of Jay enough. That tenacity is what you need. I need to do better and be better for my child. I'm not going to let this OBGYN stop me. I'm not going to let this one terrible experience with the therapist stop me. Help is out there for me. And I want you guys to know that help is there, that there are professionals out there who are dedicated to you. There are professionals out there who understand your experience, and who are willing and just happy to help. So don't give up. I think that is all that I have, and I'm happy to entertain any questions.
Thank you so much, Dr. Poole. We do have a few questions, and I'll kick things off with this one. Someone is asking, how do I communicate to a partner or family member what I'm experiencing to gain their support, the support I need? What language do they use? What do I tell them?
Oh, okay. So that's a hard one, because you would hope that any language that you used, that was a cry of help, that your partner or family members will understand that. But then, unfortunately, because everybody might be going through their own issues, it may be difficult for people to pick up. So there's something that you can do, is to explain yourself in a calm manner, to explain that this is what I am experiencing. I don't know what, and then you can say, I don't know what, if you experienced it, if anybody else experienced, but this is what I am experiencing. This is how I am feeling, and I don't know what to do with this, and I need your support. So to be calm, to explain it fully in a simple way, so that there's no miscommunication, and then tell them exactly what you need from them. And then if the person cares about you, they should say, okay, well then I'm going to help. So be calm, explain it fully and simply, and I want you to tell them exactly what it is you need from them. I need for you to support me by helping me find a therapist, or I need you to support me by taking me to my therapy sessions, or I need you to support me by listening to me. I do not need your advice. I just want you to listen, because I need a place to vent. So be very clear about what it is you need, because people are not mind readers, and they may or may not, they have their own way of dealing with things. And so they're going to try to do what makes them feel better to you, but then that might not help you. So that's why you have to be clear and very specific. Hopefully that answers the question.
No, thank you. Clear and specific. Another question. Could you explain the process in finding a therapist that is culturally responsive? So in Jade's opening, right, she talks about her journey of going through several therapists before she found one that she vibes with. So is that typical, or what is the process of finding a therapist that's culturally responsive?
Okay, so Jade's experience is not unique at all. Sometimes it may take a couple of therapists. Some of the kids that I see, especially, kids are more finicky than adults, actually. I have kids that fire therapists every week. But so that's why I said don't lose hope if the first or second person that you sit with doesn't vibe with you. And then you also don't have to just say this person is white and they cannot identify with my experience. I have a therapist and my therapist is Caucasian, and I just teach her about some things. I say, are you aware of XYZ? She's like, oh no, tell me about it. And so I'll explain to her certain phenomena, and she's willing and she's open and she can run with that. So she can vibe with me because she's open. Not everybody is like that. I just want you to know that just because someone doesn't look like you does not mean that they can't sympathize, that they can't help. I remember I had a patient who came from Pakistan, and this was for postpartum psychosis. Oh my gosh, this was a crazy situation. But anyway, her husband used to come with her to the sessions, and there were some things like that I knew that I wasn't understanding culturally, and then I just shared it with them. I said, okay, I'm not really understanding this. Is there a cultural barrier that I'm missing? Like, is there something that I can't see? And then so she would just explain things to me. Well, this is how we do this, or this is the way we think of our parents. So if our parents say this, this is what, so they just explained it to me. I learned, but I was open. So I said all that to say, just, you don't have to just cut somebody off because they don't look like you. The important thing is, are they open to understanding? And you'll know that. So they're different venues. They're how, like, I have I'm a part of a group called like Black Psychiatrists of America. So, so we have like a group together where sometimes if I have a patient that might be moving to like Oklahoma or somewhere, I'm like, okay, I'll go on there and say, are one of us in Oklahoma that I could set them up, with somebody from there, and then we'll opine or comment or help each other out. So there are organizations like that. But just because there's so few of us, I just wouldn't, I wouldn't, just resign yourself. Okay, I'm never going to get help if I can't find the Black one. Yeah.
To that, Colette? Colette. I'll add to that by saying my therapist is a white man. And I went through a white woman, a Black woman, and my fit was Dr. Shinar. And I talk about my culture all the time, and I joke about it sometimes in terms of like, I'm sharing my Black thoughts, but he is very open, willing to learn, open as far as like understanding or trying to understand what I'm experiencing, because a lot of what we go through mentally has to do with who we are as Black women specifically. So I am very thankful for that relationship, but I do want to piggyback off of Colette and say the person does not necessarily have to look like you, but they should be culturally competent.
Thanks, Jade. Okay, next question. Many people don't understand risk factors and how they operationalize themselves to our personal health or mental health. The whole health literacy aspect is missing in the framing of how we are asked certain questions. Are there any movements in the mental health realm to frame this from a health literacy standpoint? Many don't know that they even have risk factors.
So this is a burden that should be on the provider and not the patient or client. So it's up to me to be able to communicate to any of my patients on whatever level that they walk into my office. And I can say that I think I'm pretty much effective at that. My patient shouldn't have to know what their risk factors are. The only reason why I told you the risk factors is just for the sad fact that we have providers who are not identifying them for you. So, because if you walked into my office, I should be able to ascertain all that information. I should get your history and figure this out. And I can come out of my encounter with you and say, this is a 30-year-old married African-American female with a past medical history of this, who is suffering from this in the context of this. And because of that, I can say, okay, let me mitigate this problem by addressing the risk factors. So this should not, like I said, be in the hands. This is not something that's on the patient to do. So to address the question, it's like the very simple answer: making your clinician, your provider, your doctor, whoever, explain things to you in a way that you can understand. Don't let them leave until you understand exactly what they're saying. And then don't feel, I get this with all my African American patients, not all of them, but some of them. And I'm like, you should just ask. They'll wait for the white people to leave the room and they're like, okay, doc, explain to me everything. And it's like, we were all in the room. We could have all explained it to you, but it's like, there's this element of shame. Like, oh, I don't really know. Who cares if you don't know? I know, and I'm the doctor. I should be able, I'm the one that's going to tell you. But because of just, the climate, the political climate, the social climate of this country, it makes it like that exchange between doctor and patient, it doesn't make it as easy as what it should be. So how I would address that question is, do not leave a room with a healthcare professional if you don't fully understand what's going on. Make them explain it to you in a way that you can understand what's going on. And if you are explaining a problem that you have, be clear and be specific about what it is that you're experiencing and what it is that your goal, what I need. I am experiencing a great deal of I don't know, I keep getting panicky for no reason. And I would like for that panicky feeling to go away. The doctor can do something with that. I don't know if hopefully that helps.
Yeah. She followed up. So she got what she needed there. So thank you. We have one more. As a social worker who has a burden to help Black mothers, especially first-time mothers, how can I help or create in my community to help mothers who may be experiencing postpartum or just feel alone after having a baby?
So social workers, I love you. I love what you do. I love how you guys are just amazing. The one thing that you could do is to help identify when a mom is having a change of mood and connect her to someone or resources that would be able to help her. The problem is with especially Black mothers, we are 2 times more likely to experience these problems, but then less likely to be diagnosed and helped. So I think what you can do as a social worker is bring to the attention of the providers that you're working with that this person may need a mental health evaluation, like more services. So like in one of the clinics that I work in, the kiddos, like sometimes we'll have kids that, these kids are, I don't know, they be stabbing people at school and everything. And then like the social workers are like, there's something else going on. Can we get can Dr. Poole, can you evaluate them to see if there's a psychiatric, like a primary psychiatric problem? Sure, no problem, whatever. So that's the social worker bringing an issue to me and saying, this is something that's out of this social realm. Remember I said biopsychosocial? The social worker is like, see, I'm helping them with these social programs, but something else is going on here. And they bring them to my attention. And then I'm able to say, yeah, there's a biological issue going on. We need to correct this with medication.
Great, thank you. We do have a few more minutes for additional questions if anyone else wants to submit. I think I've gotten through everything that has been submitted so far. So if you do have a question, I encourage you to post it in the chat before we start wrapping things up here. So I'll give another minute for that.
While we're waiting for people to post questions, that the fear of the government getting involved with like with your child, or like DCF or Child Protective Service, is real. I have moms who are struggling with substance issues, and like they prefer to treat things on their own with their substances than to seek help, because they're like, if I say that I need help, if I admit that I'm having a problem, then they'll take my baby away. There is a very, very real fear of that. And honestly, I can say that, I mean, it's warranted, because I don't know. I mean, it's warranted, because I had this one Caucasian female patient. Ladies, this girl was like, always her Utox, which is the, when we test for drugs, was always positive for something. And she still had her child. And I'm like, what is going on? But then I have Black moms who might smoke weed. And if we were just in California, this wouldn't be a thing. But they smoke weed, and now they're being forced by the judge to do like treatment and all this stuff. So it's warranted. It's warranted. However, when you enter into a relationship with a medical provider, like I always tell my patients that I am not the popo. I'm not a detective. I'm not here to send you into jail. I really want to get to know what's going on with you. And if you're honest with me, I will do my best to help you. I have gone to the hospital, spoke with doctors, spoke with DCF workers, written letters to judges about, nope, this is a good patient. This patient listens. This patient, I don't have any concerns. And that goes a long darn way. So like, you don't have to be fearful if you have a good provider. Be honest, and we will work for you. Trust me, I will move heaven and hell for my patients. And that white lady, y'all, I called DCF and I said, I don't know who dropped the ball here, but this is the worst case of anything I've ever seen. I don't know why she still has this kid. And they even had to say, oh, well, you're right. We know we dropped the ball. There's just so many legal things and, whatever. So it's out there. It's real. People are not like, there's not as much justice that should be going around. I mean, it's just not. But when we're in the medical community, it's not, we're not trying to harm you, and it's not our job to like, make sure enforce things legally. We really want to help.
Yeah. We have a couple more questions. Dr. Poole, can you speak to action items to destigmatize mental health concerns within the Black community?
Ooh, Lord.
Oh gosh, this is such a this is really complex. And the reason why it's complex is because we have a whole generation above us that don't believe that problems are really problems, that kind of tell you, like, I was like, just today I was talking to my mom, I'm like, I'm a little sad. And she's, girl, you don't have to be sad, just, speak those scriptures. And it's just like, okay, like, yeah, that works. We need good mantras and we need, scriptures, but we have a whole generation of people that do not acknowledge that mental health problems really exist. So an action item would be, despite the resistance you get from your grandparents and aunts and all that stuff, to keep speaking about it, to talk about depression, to talk about anxiety, and to mention it when you see it in other people. So we have this thing, when we're all over for Thanksgiving or for cookouts, we have that uncle who just ain't right, or, and that it's just, no, that's not just, that is autism, or no, it's not just, he ain't right, he is depressed, or he came back from the war and he just ain't, no, he has PTSD. So an action item would be to keep addressing it, and then to name things as you see it. No, this is just ain't right, this is PTSD. No, this isn't, dad did this, he was a pedophile and molested his daughter. You know, we have to name it, because then it becomes real and it's not a boogeyman anymore. It's out. It's exposed.
Can I add something, Colette? I just want to add that by exposing the pink elephant in the room, you have to try to detach from the shame, because there's a shame that comes with speaking up and being an advocate in Black families. When you speak up about mommy's on drugs, right? We were having a nice Thanksgiving dinner. No. Mommy's there's an issue here. My cousin, she didn't want to touch her baby for 3 months. She's still not well. Jade, why do you always want to bring up negative things? No. So we have to be powerful in our words, so that when that whole shame throwing comes at us, we're able to navigate that as well. And I think speaking to a therapist about that, or speaking to a friend who encourages therapy, can help you get through those moments, so you have the power and the confidence to have those conversations. My aunt, she's on this call. I talked her to death about anxiety, OCD, this and that. She was like, Jade, get over it. Jade, you'll be okay. And then one day, you know, a year or two later, she called me and she said, I think I'm having intrusive thoughts. Now that is changing the cycle from someone who didn't believe that this was happening, or couldn't understand, because my aunt's young, she's 50, but she comes from that age of like, get over it. Someone who couldn't identify with it, to someone who was talking to me about what she was experiencing.
Right. And so I want to like really latch onto what you were saying and talk about that shame. I always tell my, usually my adult patients, that fear, shame, and guilt are not good motivators. But what do we have a lot of in the Black community? Fear, shame, and guilt. And when you have fear, shame, and guilt, you fall into negative patterns. I guarantee you, I will bet my medical degree on this, that if you start to fall into negative patterns, you pick up the phone and call that boo that you know you're not supposed to call, you start taking more sips than you know you wanted to take at the beginning. You know what I'm saying? When you start falling into that negative pattern, I guarantee you, you have to sit back and say, where is fear, shame, and guilt? I let it in my life somehow, and I guarantee you, you will find it. And so that is how we keep this whole thing that we should be superwoman. This is shameful that I need help. No, it's not. No, it's not at all. But then if you think about what I told you about that monkey, right? The monkey and the baby. How did we, the enslaved women on this continent, they were having babies, having to neglect those babies to breastfeed white babies. What do you think that did for those? What do you think it did for the mom? What do you think it did for the baby? What do you think it did for the white baby they were suckling? There's like a whole chain of just effed up stuff that is in our genetic material, and we're not going to get it out until we really dismiss fear, shame, and guilt from our lives.
No, that was amazing. I think a lot of us need to hear that. And I think we have a couple more questions, and then we're going to wrap up. What are ways to manage the cost of accessing mental health support? What should I expect in terms of the number of visits I will need? And are there other community resources that can support me in addition to a mental health practitioner?
That is a good darn question. Okay. No, it really is.
Yeah.
So the thing is, depending on the type of therapy you're enrolled in, that would say the number of treatments that an insurance company is willing to pay. So for example, if you're like in CBT, there's a specific amount of sessions. If you're doing psychodynamic psychotherapy, you're gonna be in that room for years. And it'll probably be weekly visits. And then most of those kind of providers are out of pocket. Some people do sliding scale costs. This is sometimes a cost that will have to just come out of pocket. But there are community centers, like one of the ones I work for in Connecticut and New Haven is Clifford Beers, where we have a lot of things within one building. We have a lot of wraparound services. They can come and see me, the psychiatrist, and then they can come and see their therapist. So there are some community health centers that have that type of medical mental home model. So you would have to seek out a community clinic for that if you don't have the money to pay out of pocket. And then it's the type of therapy that determines how many sessions you will need. And then the other thing, sometimes, like if it's important to you, I'm sorry to say that they're just not cheaper avenues to do it. If it's important to you, you're gonna have to figure out how to pay for it. If you want something like that, psychodynamic psychotherapy, you don't have to get that. Like I said, you could find a really good therapist in a community health clinic, and then that'll be free, covered under your insurance. But if you really wanted to go back into my childhood and do all those things, that might be something that might have an out-of-pocket cost. So community health clinics is a good one. There are some people who do like cash-only practices, but in order so they could feel useful to the world, they also do a couple of days of sliding scale patients or even pro bono patients, but you would have to seek that out and find those people.
Can I add something, Colette?
Oh wait, one more thing. And then if you're near a hospital that has a training, like a university or something like that, they often have those clinics when they're training new social workers and new psychologists and new psychiatrists who take on people, and then it's at a cheaper cost or free cost. So that would be like an academic center, like if you're in New Jersey, like a UMNDJ, like a Rutgers, because they have students who are there. So those kind of clinics are cheaper or free.
I just wanted to add that if you do have insurance, most of the time your insurance will cover some type of therapy, but it may not be with the person that you like. And that's what I experienced. So therapy with the cognitive behavioral therapist was free, right? I had a $10 copay, but I didn't vibe with them. So you may be able to go through your insurance and find a couple people that you like. You'll just have to mitigate that whole process, right? But then you also can use your FHA card, but you have to fight for that. You have to make sure you're doing all of the things to make sure you get your money back. So I've gone through that battle, and it is a hard one, but you have to be an advocate for yourself.
Yep. Okay. No, thank you. I think we got through all of the questions. I'm just going to give you folks just some information about next steps, and then I'll turn it back over to Jade for closing statements. Thank you so much to everyone that participated. This is the first event of a series, a 3-event series that we are hosting. And because of your participation and attendance to this first part, you guys automatically get a discount to the second event, which is scheduled for next Saturday, May 16th from 1 to 2 as well. So you'll get the link to that in an email probably sent out within the next hour. Additionally, we want feedback. We want to know how we can improve this series. So it's a brief survey. It's less than 10 questions that will be linked to the in the thank you email that will go out shortly. So we really ask that you take a few minutes and give us feedback on your experience today. And with that, Jade, you can close us out.
Thank you guys so much for being a part of this conversation. When I envisioned She Matters, I thought of a place where we as Black women could go for community resources and culturally competent therapists. And our goal as a team is to make sure that that happens. I know that postpartum anxiety and depression can be lonely. I know anxiety and depression can be lonely, and I know being a Black woman can be lonely. So we want you to know that we are here for you, and this is the one of many. And we hope that you join us. You can join us through Instagram, Facebook, Twitter. You can send us emails directly. We're here for you. And I hope that you are all safe during COVID-19 and your families are safe. And we look forward to seeing you next week. Thank you.
Thank you, everyone. Enjoy the rest of your afternoon.